One instrument that we have created to improve our healthy public policy practices in Vancouver Coastal Health is through the creation of a policy monitoring framework. The framework has three components. One is information gathering. The second is theoretical frameworks, the application of them. And the third is team analysis. And you can imagine these three components as a Venn diagram. And in the middle, we are looking for policy windows of opportunity. So our hope is that when a policy of window of opportunity is identified, that we are ready to jump through. So behind the scenes, we are doing all of the regular work of the relationship building, the evidence gathering, and all of those things. But we do monitor on a weekly or a bi-weekly basis. I'll talk about why all three components are important. So first, with respect to information gathering, you can imagine that if you didn't have this, then the work wouldn't be evidence-informed. So this piece is really important. In terms of theoretical frameworks, these are also important because they add rigor and they provide best practice guidance to the team about potential policy actions to take. And then the last one is team analysis. Without the human component, we wouldn't have the critical thinking and we would potentially miss out on opportunities to collaborate with partners. So those three things go together. I'll talk a little bit more about the information gathering. This is done in two ways. Firstly, it's done within the context of relationship, which is at the heart of everything that we do. So we build ongoing relationships with folks in community, and in particular with local government staff. So sometimes they give us a heads up about a motion that might be coming to council, and then we have a little bit more lead time to see, is this relevant for public health? Is it likely to pass anyways? Do they need our support? We really check in with staff to say, would a letter be helpful? Is there any evidence that you might be in need of? That's really important. Also, just seeing people at events and hearing about things that might be coming up so that we can alert our team, and in particular the medical health officers that we work with. So they often speak in front of council. We do hope to lend support, but sometimes we're going to be on record in terms of opposition that something might be harmful to the health of the population. So it's very much relational. And there's a piece of technology that we've developed that we're very proud of. It's in the pilot stage. It's called PAM. It's a policy and monitoring system. So this system sits within the broader Office of the Chief Medical Health Officer, meaning it is meant to meet the needs of all of the folks working in that office, not just in the Healthy Public Policy Unit. And it is a collaboration between the epidemiologists who work in the Public Health Surveillance Unit and the Healthy Public Policy Unit. And what it does is, through the code that they've developed, it kind of works on a daily basis to look for health priorities in municipal council agendas or in municipal council meetings. It looks at specific media discourse on topics that we've identified as priorities for public health. It would be looking at legislative changes or other policymaking entities, and it gathers all of that information up and puts it into a dashboard that our team can use to help us prioritize and strategize around what actions are we going to take next. We're about 80% of the way there in the development of this tool. We're piloting it right now. And so at the moment, we are doing the policy monitoring both manually, online, and in the context of our relationship and community. But it really does help us in terms of how are we going to show up with and for our partners and bring that health lens to the work that is taking place in community with respect to the social determinants of health.